If you are over 50 or turning 50 soon, big changes have already started in your body. What conditions are more likely to affect you? Does the risk of developing autoimmune diseases increases with age? What foods to eat and what to avoid? And how can you protect your joints naturally? Most people over the age of 50 do experience a little bit of joint pain or a little bit of joint stiffness. But how much is expected and when should you be worried? This is the question. In this video, I will explain what is normal or what is expected in terms of joint pain, but also I will explain to you when you should be worried. I will tell you about the most common autoimmune diseases and arthritis that can affect you after the age of 50. And not only that, but how to recognize them quickly. And I consider this crucial information that you won't find it easily. I am Dr. Girnita, a rheumatologist with over 15 years of clinical experience treating arthritis and autoimmune diseases every day. What's normal after 50? Let's start with what's completely normal. As we age, some wear and tear in our joints is expected. When you wake up in the morning, you might feel a little bit stiff. But that should go away in a few minutes after you're up and you start moving. And if you're working a lot, especially if you have a physical job, or if you have a busy day, like you're gardening, or if you sit at your desk too long, then again, you might experience a little bit of joint pain or back pain. Your joints will feel stiff until you start stretching and you start moving around. Why is this happening? Most of the time, this is a testimony of our slow wear and tear in the joints. Think about your car tires. The more you drive, the more you wear them off. Is that correct? The same is with our joints. As we age, and think about this, 50 is about our half of our life expectancy. I know, this is a wake-up call for all of us. The cartilages in our joints will thin out, the fluid in our joints will decrease, which will cause the rubbing of the bones in our joints, and it's going to cause the stiffness. But when you start moving, the cartilages in your joints, like the knees or the hips, they will produce more fluid and that stiffness will go away. How about the cracking and the popping sounds in our joints? Are they normal? We call these cracking sounds crepitus, and they are quite common and usually they are harmless. One of the main reasons it happens is because of the gas bubbles in the joint fluid. These bubbles form and they collapse as you move and stretch, creating that popping sound. And it can also occur when ligaments or tendons, those tissues that connect and stabilize your joints, they shift slightly out of the place and they snap back during the movement. And this is particularly common in larger joints like your knees, shoulders, or ankles. In some cases, the joint cracking can be because of the cartilage wear and tear, especially when you age. When the cartilage thins out, becomes uneven, the bones or the joint surfaces might rub against each other, leading to a grinding or popping sound. And this is more common in people that have osteoarthritis, and I will talk about that a little bit later. But the question is, when should you be worried? There are some signs that will tell you that something is wrong and your joint pain is more than just aging. And I call these red flags. If you have morning stiffness that will last more than 1 hour every day, if you have constant pain, if you have red and swollen joints, if you have pain on both sides of your body at the same time, like both hands, both feet, both shoulders, both knees, if you have one joint very swollen, red and painful, or if you have other signs like low-grade fevers, severe fatigue, if you lose weight, if you have rashes, or even headaches or blurry vision, come to see a rheumatologist like me, because those are not typical signs of wear and tear. Now, let's go even deeper into something that could save you years of unnecessary pain, because I'm about to show you specific signs that some doctors may miss when your joint pain isn't exactly what it seems. But before we dive in, I should mention that this is exactly the kind of complex diseases I handle every day at Rheumatologist on Call. If you're tired of getting incomplete answers about your joint pain, then click the button above to learn more about how we can help you to get to the root cause of your symptoms. Let's start with gout. This is often called the disease of the kings because it was thought to be linked to the rich diets. But here is one thing. Gout is not just about eating too much red meat or drinking too much alcohol. It is related to your genetics and how well your kidney function is to excrete that uric acid excess, because the excess in uric acid that will deposit in your joints, vessels, and it can deposit even in your heart, and that can cause gout. Science has shown that your genes determine 60% of your risk of developing gout. That's right, more than half of the reason you have gout is something that you cannot control. So genetics play a big role. Certain genes can affect how your body processes uric acid, making you more susceptible to get gout. So if you have gout running in your family, you are by default at a higher risk. By age 50, your kidney function starts to decrease gradually, making it harder to clear that uric acid, which will tend to build up in your joints. So if one morning you wake up with a sudden hot, swollen, and excruciating pain in your big toe, then that's a classic sign of gout. How to lower your risk of developing gout? We said that 60% is genetics, but 40% is what you do every day in your life. So my friends, stay hydrated. You have to keep those kidneys flushing with water. Stay away from drinking beer, hard liquor, or even wine every single day. Eat less meat, organ meats, and shellfish, because that will increase the uric acid production and maintain a healthy weight, as excessive weight and obesity are linked with more gout attacks. Now, have you ever had your uric acid levels checked? This is a simple blood test that you can tell your doctor to get if you know you have an increased risk of gout. Next, let's talk about polymyalgia rheumatica, or PMNR. Now, if you wake one morning with stiffness and pain, especially in your neck, shoulders, and hips, if you develop low-grade fevers, weight loss, difficulties using your arms or raising them above your head, if it's hard for you to get out of the chair or go up on the stairs, but then as the day goes by you start feeling better, you have to think about polymyalgia rheumatica. It's most common in people over the age of 50, and it can be very disabling. In my practice, I had many patients that I diagnosed and successfully treated for polymyalgia rheumatica. The idea is to just recognize the disease quickly, because with the proper approach or the proper treatment, which is a low dose of prednisone, the patients will feel fantastic in just a few days. They have this quick response to treatment, which actually confirms that we are dealing with polymyalgia rheumatica. But about 10% of patients with polymyalgia rheumatica can develop a much more complicated autoimmune disease that is called temporal arteritis, or it's called giant cell arteritis. And this is a large vessel vasculitis, an autoimmune disease causing inflammation in the big vessels of your brain. And this disease must be recognized immediately, because if it's not treated quickly, it can cause severe damage. Giant cell arteritis may affect the arteries in your head, as I said. And if you have polymyalgia rheumatica symptoms, and then you start developing a sudden severe headache, blurry vision, go to the emergency room immediately, because you need to be evaluated for GCA, or giant cell arteritis. If you have pain when you chew food, if you have to stop chewing food, if you have sudden vision loss, even for a few seconds, if you have stroke-like symptoms, then again go to the emergency room for urgent treatment, because that treatment means a higher dose of steroids that needs to be started right away to prevent complications like the vision loss or strokes. We will move on and we will talk about something less severe that we call osteoarthritis or the wear and tear arthritis. By 50, your joints, as I said, will start wearing off. And the wearing off especially happens if you played some professional sports, if you are involved in a lot of running, a lot of jumping, high impact exercises, which again will cause micro trauma through your cartilage, and that will accelerate the wearing off of the joints. But there is also something else that can contribute to osteoarthritis, and that is your weight. And I often talk to my patients with arthritis about how important it is to maintain a healthy weight, or I actually help them to lose weight with our Oasis program. And I will post a link in the video description so you can learn more. Because with every 5 pounds that you lose, you're gonna gain 5 more years of use on your knees, and you will avoid that knee replacement. Now, how can you protect your joints naturally? You should continue to stay active, but with low impact exercises, something like swimming or yoga. And if you have knee pain, then do physical therapy, because you need to strengthen the muscles around the joints. And don't forget to focus on an anti-inflammatory diet. Think about the leafy greens, berries, and fatty fish. If you are a woman and you are postmenopausal, your risk for autoimmune diseases like rheumatoid arthritis will increase. Now you're going to ask me why. Because with menopause, your estrogen level decreases significantly, and that will trigger more inflammation in your body. Now, if you encounter a virus, or if you have that genetic predisposition, let's say your mom or your sister had rheumatoid arthritis, then your risk is doubled. What are the signs that you should look for? If you start developing symmetrical and bilateral joint pain in the hands and feet, if you develop morning stiffness that is longer than 1 hour, but then it improves along the day with movement, think about rheumatoid arthritis. There are also many other signs like fatigue, dry eyes, dry mouth, even low-grade fever. But joint pain will be the symptom that will bring the patients to my office. Can you do something to reduce the risk of rheumatoid arthritis? Yes, you can. Of course, we cannot change our genetics, but actually there is scientific evidence that will show maintaining a healthy weight, adopting an anti-inflammatory diet, avoiding all sugary drinks and processed foods, exercising, sleeping 8 to 9 hours every night, and managing stress will decrease your risk a lot. In my recent book, Thriving with Rheumatoid Arthritis, I give you actionable steps that you can implement every day. So check it out. Now, you should ask your doctor to check your vitamin D level, because if it's low, make sure you will supplement that. Research like this study called Vital, published in 2022, it showed that people using vitamin D, 2,000 international units, and fish oil, 1.5 to 2 grams every day, had a lower risk of developing autoimmune diseases. Now, turmeric, it's another great addition to your diet. And there are many studies that prove that it has a great anti-inflammatory effect. And actually, some studies in patients with rheumatoid arthritis show that taking a supplement with turmeric about 1 gram per day for 90 days will reduce the pain, the stiffness, and the joint swelling. But wait, not only that, the use of turmeric was also shown to reduce the needs to use anti-inflammatory medications like ibuprofen, naproxen, diclofenac. But I have to warn you about something. As you could see, your lifestyle can either help you prevent or make those autoimmune diseases and arthritis worse. So, in my opinion, it is our choice that will make that risk higher or lower. So that's why I will advise you to be careful and start making small changes to your diet. Incorporate more anti-inflammatory foods. Start exercise and learn techniques that will help you manage stress. So what's going to be your next step? If you are experiencing any of these symptoms, or if you want to stay ahead of your risk, make an appointment with a rheumatologist like me today, because knowledge is power and early action can change everything. And now that you have learned about the most common autoimmune diseases and arthritis that you encounter over the age of 50, you should also learn about the best supplements for autoimmune diseases from this video.